Okay, so today I'm going to be presenting to you about the youth pregnancy crisis in Guatemala and its impact on overall health and poverty in the country. Okay, so I found out about this crisis when I visited Guatemala last year with a small group from my school, and we traveled with an organization called the Cooperative for Education. And for those of you who don't know a lot about Guatemala, it's a very impoverished country, and a lot of this stems from the fact that a quarter of the population is actually illiterate, and specifically for young girls, there's very limited educational opportunities. So the Cooperative for Education, which I'm just going to refer to as co-ed, is trying to break this cycle of poverty in Guatemala by educating young kids so they can grow up and have better jobs and bring their families out of poverty. And so at one of these schools that my classmates and I traveled to, we met a young girl who was only around 13 years old. And we got to go to her house because co-ed was bringing their family some things that they needed, like a water filter, an air mattress, and things like that. And when we got to her house, she came out with this tiny baby in her hands. And my friends and I were all thinking like, oh, maybe that's her younger brother or like a family member or something. But then she asked us like, oh, do you want to hold my baby? And this was super shocking to all of us because she was around our age and I couldn't believe that she had just given birth. And so I thought, maybe this is like a one-time situation that I would see. But as I traveled throughout Guatemala, I realized that this is a widespread crisis that is affecting women all over the country. So here's a statistic to just show you the magnitude of the issue. About half of women in Guatemala have children in their teens. And so how is this a public health crisis? This is a public health issue because it's affecting the health of women and children all across the country. And it can also be very dangerous for teenage mothers. So some facts that I put on the screen are that babies born to mothers under 20 and living in poverty are 50% more likely to be stillborn, premature, malnourished, or not live past a few days. In addition, the complications of childbirth are very severe. So the second leading cause of death among 15 to 19-year-olds is actually childbirth, just due to the lack of proper medical resources. And the most important aspect of this would be that when women have children at a very young age here, they're set on this particular path where they're more likely to drop out of school and work in low-paying jobs, be forced into economic dependence, and also more likely to face malnutrition and discrimination. And so here are the four main categories that I think are causing the issue of high teen pregnancy rates in Guatemala. So the first one would be a lack of education. And this is both a lack of general education and sexual education. So normally in this culture, it's just easier for families to have their daughters married at a young age and then become economically dependent on another. But in order to prevent this, it would be helpful if women went to school and could become economically dependent on themselves. And so that's one of the issues, is the lack of general education. And the other issue is a great lack in sexual education for young girls. And a big part of this is due to religious and cultural norms that prevent access to this information. And so I have a quote here that demonstrates this very well. So it says, this is a quote from a teenager in Guatemala, and it says, "Mothers are not informed, and mothers feel ashamed that they cannot even tell the names of the body parts." So this shows that from generation to generation, women aren't learning about their bodies and about reproductive health, and they can't even pass that information on to their children, so they feel embarrassed about that. And so girls aren't able to make proper decisions because they don't know how their bodies work and function. And the second main cause of youth pregnancy would be sexual violence in Guatemala. So as I showed on the screen here, in just 1 year, 4,000 10-year-old to 14-year-old girls were the victims of rape. And the saddest part about this is that most of them were victims of close family members. Moving on, lack of health care is also responsible for this issue. So there's a huge unmet need for contraception in Guatemala. Only about 5% of women report that they use contraception regularly. Also, there's many women who are unable to get access to abortions every year. So tens of thousands of women are having unsafe abortions, ending up in hospitals and hurting themselves very badly each year. And finally, many people in Guatemala are often traveling to find work due to poverty, and so they're not able to see doctors regularly and go to the same healthcare clinics for follow-ups. So a lot of them are just ignoring important health issues because they don't have access to clinics depending on their location. And so I think the main underlying cause of all of these different of lack of education, sexual violence, and lack of healthcare all ties back into poverty, because 60% of the population in Guatemala lives below the poverty line. And in addition, I think that teen pregnancy is also a cause of poverty in Guatemala, because when women aren't educated, it's less likely that their children will be educated, and it kind of continues the cycle of working low-paying jobs instead of kind of getting up to higher paying jobs and bringing their family out of poverty. And so what can we do about this issue? I think the three things that we can do are improve the areas of education, finance, and public health access in Guatemala. So the organization that I was describing earlier, the Cooperative for Education, is already working to do this by educating young girls. This gives them a chance to create a job for themselves and help bring their families out of poverty, rather than being married at a young age, having children, and becoming dependent on others. And also in the area of education, sexual education needs to be expanded to all schools so that young girls can learn about their bodies, so that they are making educated decisions on whether having children is right for them or not. Second, in the area of finance, microloans could be given out to women so that they can start making their own businesses or small companies and become economically dependent or economically independent. And so they're not forced into marriage and having children at such a young age. And the third big solution would be improving public health access for women all around Guatemala. So this would include creating more clinics all around the country. So if women are traveling to find work, there's always health care nearby. Also improving access to contraceptives for women. And then finally, improving pre and postnatal care so that this decreases mortality rates for mothers and their children. So these are three solutions, and organizations like the Cooperative for Education are already helping to fix this issue. And if you want to get involved, you can always look up the Cooperative for Education's website and donate to them. So these are my references, and then my acknowledgements. I just want to thank my parents and my friends for supporting my pursuits and encouraging my passion for global public health. And I just put my email there if you want to contact me. Thank you.